Hola, Vardians. What's the difference between a physiotherapist and a physical therapist? The answer will be at the end of the episode. Before I jump into the episode today, again, I want to take a second to say thank you all. We are less than 50 listeners away from reaching 1,000 downloads, and I am so excited. I can't wait. I also did want to just make one more announcement. If you or anyone you know are into real estate or invest in real estate or want to learn more about real estate, go ahead and check out my husband podcast, More Real Estate. That's more Moore, like the end of our last name, Real Estate. And you'll find it on any podcast platform, just like you'll find Healthcare Boulevard. And one day y'all might hear his voice here. And yeah, enjoy the episode. Hey y'all, I hope you're well. Welcome to another episode of Healthcare Boulevard. This is a podcast where we shine more light on healthcare, and our goal here is to provide more options to people looking to choose healthcare as a career path, regardless of their background. My name is Sena Kakpomo, and I am your host and creator here. I thank you for tuning in. I appreciate your support. Remember, you can tune in on YouTube or wherever you get your podcasts. Without further ado, let's get into today's episode. Alrighty, audience, welcome back. How y'all doing? We are here for another interview, another international interview. I am very excited. Y'all can guess where she's from, where she's practicing, but you're about to find out in a few seconds. So I am here with, I'm going to have her say, okay, it's Dr. Kaviarasi. Did I say that right?
Yeah.
Oh, yay. I'm very proud of myself. So I'm here with Dr. Kaviarasi, and she's a physiotherapist, again, also called physical therapist. I'll introduce her. We'll get right into it. Good morning for me and good evening for you. How are you doing?
Hi, Simon. I'm doing good. Thanks. Hope you're
Oh,
doing well.
I am well, thank you. It's a little too early for me, especially since I was having some trouble sleeping, but I am pumped for this interview, so I am excited. Tell us a little bit about yourself.
Thank you. First of all, thanks for inviting me here. It's a great pleasure being in your interview.
Of
So, talking about myself, I'm Dr. Kaviarasi. I'm a physiotherapist. I was specialized in cardiorespiratory sciences. I was based in Chennai. It is in India.
Okay. So with that, that's a lot to unpack, partly because I didn't even know, and I'm sure it's a thing here as well to specialize in different specializations like cardiotherapy or cardiopulmonology. But let's focus on you. How did you decide to become a physical therapist or physiotherapist?
To be honest, it is my mom's wish to be a physical therapist
Mhm.
because I was want to be in MBBS. I was aspired to an MBBS. At certain
Okay.
situations, I cannot able to do that. So I was want to be in medical profession where I actually seen lot of newspaper ads on my teachers have read to me, but
Mhm.
my mom's wish is to be a physical therapist. She has seen some newspaper ads where it is a profession actually a part of a medical profession. So she asked
Right.
me, why can't you try a physical therapy as your profession? So I entered into it. Then I liked it. Then it becomes my a passion for physical
Yeah.
therapy. Then I continue to do that. So it been my 8 years of my profession now.
8 years. Okay. So I had to provide a PT here recently from practicing in India as well. And she, from my understanding a little bit from my talk with her, so there are different levels, right? You can start practicing as a physical therapist with a bachelor's degree, but then you can go all the way up to a doctorate. Am I right on that?
Yes, yes. First, we have to do like bachelor's like 4 years and
Hmm.
6 months of internship. It is like bachelor, we call it as undergraduate. Then if you're interested, you can go for MPT, which is master in
Mm-hmm.
physiotherapy, that is the postgraduate. Then we have doctorate, like PhD. So
Okay.
we have
So
3 levels.
3 levels. Perfect. You have you right now you finished your doctorate already, right? You went to the highest point.
I did
What
like my MPT. I did my 2 degrees. I went to do my PhD. Yet to do.
okay. Okay. So wait, you say you are working on your PhD right now?
No, I was not started. I'm yet to start.
Okay, you're about to start. So you right now you completed your master's, right?
Yes, yes,
Okay.
yes.
So one after you're done with your bachelor's degree, how long after that does it take to get your master's degree and what's the process?
I've joined immediately after my bachelor's because
Mm-hmm.
I was so fascinated in my internship to actually look after the cardiorespiratory patients. When
Mm-hmm.
I was in bachelor's, when I do internship, when I enter into intensive care unit, it is always chaotic. It is so scared to see patients in ICU, seeing that those monitors, we don't
Yeah.
know what is really happening inside when we are like novice into the intensive care unit. So I was really fascinated, and sometimes you're scared also. In
Mm-hmm.
order to come out of this CAD, and I was really fascinated with cardiorespiratory. I was immediately joined the post graduation after my undergraduate.
Okay. Now, as your specialty in cardiopulmonology, how did you make that decision to specialize in that area?
My decision to be a part of a cardiorespiratory therapist.
Mm-hmm.
One thing I would say, it comes from my professor.
Mm.
She
Okay.
always had this fascination. She always used to say how we treat different kinds of patients. She used to say that every patient is a cardiopulmonary patient, not
Mm.
just because they are patients with the cardiac pathologies or pulmonary pathologies. Even I talk to some person, when I talk to a healthy adult, I see how they are breathing,
Mm-hmm.
whether they are using their diaphragm, which is a major muscle for respiration. I
Right.
actually see them, actually observe them, whether they are breathing correct or incorrect. See, every
Yeah.
patient is a cardiopulmonary patient. So
Right.
breathing is the essential part of life,
Mm-hmm.
right?
Mm-hmm.
So
That's
we
that's
handle this
interesting.
kind of, yes, we handle this kind of patients with our specialty actually.
Right. As a physical therapist treating patients with cardiopulmonary disorders or ailment, what are you doing for them or with them?
Okay, we have various protocols. We do cardiac rehabilitation, we do pulmonary rehabilitation, we do breathing training for them. Most of now I was working with post-COVID patients. Okay,
Okay.
for them I was doing a lot of breathing retraining, chest mobilization exercise. We are helping them to drain out their secretions. I was treating a patients for the last week who had post-COVID panic attack. So we used to treat those kind of patients of it.
Okay. So, and please correct me if I'm wrong. It seems to me that the the position, your position as a physical therapist or physiotherapist in India is slightly different. It seems like you have a wider scope of practice than our physical therapists in the US and perhaps other countries, because over here our physical therapists or people in the physiology area oftentimes also deal with the muscular system
Okay.
more than helping with breathing. So we have like different titles and different field in medicine to deal with different things. It seems like, because we have a respiratory therapist. I don't know if that's a field of medicine in your country. Is that a thing, or is that just no? Because
Actually, we have respiratory therapists as
mm-hmm,
different, and we
mm-hmm.
have a physiotherapist who are specialized in cardiorespiratory as different.
Okay, so then what is the difference between what the respiratory therapist is doing and what you are doing as a physical
Actually,
therapist?
more or less, it is very close, but we don't
Mm-hmm.
actually operate or get a chance to operate with the mechanical ventilators, where the respiratory therapist will do.
Okay, so then are you seeing patients once they are done, let's say they're done getting the respiratory help, and you're helping them get back on their feet in terms of moving? Is that is that
Yes,
essentially
exactly, exactly, exactly.
okay?
We help them to do so.
Okay, I see. So the specialization
is in, okay, let's make sure you continue to breathe and you can move better and make sure your body mechanics are working after whatever you may have gone through in terms of cardiopulmonology disease.
Until they get discharged from the intensive care unit to their ward, until they go to their home, then they come for the review. We are here to help them.
I see. Okay. Thank you so much for that. I just wanted to really unpack that. Because as you understand, we have, we are in different systems. There's healthcare across the world. Anywhere you go, there's a version, a different system of healthcare, but the titles and the scope of practice is usually different. Like where I'm from, I'm African, and we have a different healthcare system than over here, or maybe Canada or even Mexico. So I'm very intrigued to find the differences in healthcare system in different countries. So I really appreciate you going through that baby step with me.
Sure, sure, sure.
Now, in your capacity and your side of the world, how would you describe physical therapist or physiotherapist to somebody who may not have heard of it, or somebody like me who may not have known the physiotherapist in India capacity?
Okay, to people who have never heard of my profession, I would say healthcare provider who don't prescribe you a single medicine,
Mm-hmm.
who does not do any invasive procedure, but they make you walk independently, they make you sit independently, they make you stand independently, they make you to do all your activities independent, they will increase your quality of life, they will heal you, they care for you.
Mm-hmm.
This
Mm-hmm.
profession speaks for itself.
Yeah,
Yes.
yeah. Oh, that's amazing. I love that definition. That's
Yes, it is
very
a
like,
noble, yeah, it is a noble profession where you don't have a single medicine to increase your range of motion. You don't have a
right.
medicine to increase your muscle strength. Yes, it's done by a physiotherapist. I'm proud of that.
Yeah, yeah, that's amazing. Now, what settings are you practicing right now?
Right now, I was into academia. Like I was working as an assistant professor in a private college in Chennai itself. Part time,
Mm-hmm.
I was working as a tele-rehabilitation consultant,
Okay. Wait,
and
what
that's
are
how
you
it is
doing
going.
part-time again? I'm sorry, I don't think I caught that.
I'm working as a tele-rehab consultant.
Telehealth. Okay. All right. And
Tele-rehab.
okay, so what is how did COVID-19 change your way of practicing, if any, uh as a
We
physical
cannot
therapist?
able to make the patients in person. That was a major difficulty because
Mm-hmm.
everything we cannot see in a video call. We need to assess the patient, we need to touch a patient, we need to palpate them.
Right.
So that becomes very essential. And I see personally I have rejected for my job. There are a lot of ups and downs. It's a roller coaster for the past 1 year for me.
Mm-hmm.
I should admit that also. So pandemic has made a lot of challenges for everybody's life for the past 2 years, and I'm
Yeah.
also one of the being
Yeah.
part of it.
Of course. Now, what are some of your favorite part of your profession?
My favorite part of my profession, I would divide this into two. One is academia, where I was working as an assistant professor. I would love to teach my students. So I was reading, learning every day. I was an avid learner. My students used to bring a lot of questions to me, and I was always keen on taking their interest seriously. I was like always making the complicated things into very simpler one for them, which
Right.
they may take as. I don't only teach subjects. I always have this kind of teaching them personality, attitudes, beliefs, how to treat their patients, how to use a positive words in front of the patients. So these are all
Mm-hmm.
some aspects I love to my students, teach my students. So
Right.
what I love from my second thing, I would say like treating my patients.
Yeah.
Okay. When they text me that I sleep better after my session. So these are all the things that makes me really happy. Sometimes I
Mm-hmm.
want to be a patient advocate also.
Yeah.
They don't
Yeah.
know what decision they are supposed to take. I help them to do that. So
Mm-hmm.
that will be my
Mm-hmm.
favorite part of my profession.
That's amazing. And what are some challenges you faced?
Challenges that I've faced, like there are a lot of challenges in every profession. As I would say, first thing will be when I was trying to do some researches, that getting fund is one of the difficult phase, I would say, because you may have interested or fascinated topic, but getting funds or processing that fund would be a little challenges. And second thing, I would be saying the referrals, because here practicing in India or somewhere else, I would be saying like you need a referral from the physician.
Mm-hmm.
Sometimes the patients need a rest, they should be hydrated, they should be managed for their stress, or sometimes they need just physical therapy alone. But
Right.
the physician, sometimes they may have to take a referral from them, then have to treat them. So sometimes it would be the challenges, like we are decreasing the burden from the patient. If they would have known, physical therapy would be their first choice.
Okay. All right. And once you did your 4 years or so in bachelor's, how long was your master's degree
It was two
education?
years.
Two
It was
years?
two
Okay.
years.
Okay. And did you have to take it like a board exam or like a national exam to finish to be where you are essentially?
We need to take a main exam. We have one exam at last. We do
Okay.
for every 1 year. We have one exam at the end of our year. So I did two main exams, and that's
Two
enough for our
minutes.
yes
Okay.
post
And
graduate.
at the bachelor level, once you're done with your education and your externship, do you have an exam to pass before you can actually start working?
No, I don't have any certain exams after that. We did only
Uh-huh.
after my 4 years of graduation. We did 6 months of internship.
Okay.
And before starting my post graduation, I did an exam. I did an entrance exam. I got it selected based upon my ranks.
Gotcha. Okay. All right. And give us an idea of what your professional day is like for you at work.
About my profession, sorry.
Yeah, no, sort of walk us through your day at work, a day for you at work.
My typical day of work. Okay,
Yes.
it is like
Mm-hmm.
8 hours of work where I went to academia. So where I'll be teaching a students as part of my professions. Though now my work has been like this, getting
Okay.
into an academic teaching students.
Okay. Now, getting into academia, was that your choice, and why did you decide to teach?
Teaching is always my passion.
Yeah, that's
Yeah, that is the
amazing.
only reason I was getting into that. But I also love to treat patients. That is why I have been into telerehab.
Okay. Now, do you see yourself becoming full-time teacher or professor in the future more so than seeing patients?
Actually, I did not set a future for that. Up now, I was being a professor. When I was trying to take my PhD, then I will be a full-time research scientist. I hope.
Gotcha. I love it. I love it. You are just making the whole field work for you, which is beautiful to see. How is your work-life balance?
Up now, it is hectic. It is very hectic up now. But
Yes.
I try to keep my balanced life. When I come home, I won't take my college things. I finish everything up there. But it when comes also, I try to make time for my family.
Right.
So hope this too shall pass. My hectic life shall
Mm-hmm.
pass.
Yes, yes, absolutely. Now, when you do get stressed, as I'm sure you do, being in your profession and in this time of life, what do you do to sort of cope with stress?
First thing that comes to my rescue is my meditation. I
Yeah.
always do that. Second thing, learn the art of saying no. Don't take extra burdens. Say this
Mm,
art of learning no to sometimes you have work coming from your friends, your relatives, or from your colleagues. Don't take extra burdens. Tell them
mm-hmm.
no politely so that your stress can be reduced so much.
Right. Now, what are some growth opportunities in your level as a physician? I mean, I almost said physician assistant. That's what I am. What are some growth opportunities for you as a physical therapist right
We
now
have
at
a
your stage?
very yeah, we have a various growth opportunities. We have a lot of places to work, like in hospitals, in clinics, as a fitness coach, as a wellness coach, as a health coach, as an ergonomist or research assistant. There are a lot of growth opportunities that we have to keep ourselves updated. We have to
Mm-hmm.
equip our skills so that we can get the places.
Mm-hmm. Mm-hmm. And how easy is it to move around in these roles?
How easy?
Yeah, how easy is it to move in the different settings that you can work in as a PT? Can you just apply to a research place and do research and clinic, or do you have to do any schooling or any extra certification?
Okay, it is all the practice, and next you
Mm,
have to take a lot of courses out there. There are a lot of courses people are putting every time they are get certified. Go and get certified. Take a
mm,
lot of courses, get certified. Equip, always have the skills. Always put yourself in the shoes of learning so that you
mm.
can have a places to go. You can put yourself into a position that you can be a qualified great physical therapist.
Right. Now, with you being as involved as you are, how do you keep your, I almost feel silly asking that question. How do you keep your education up to date?
Okay, I do a lot of online courses. Okay, I
Mm-hmm.
take online courses at least 2 to 3 in a week, like
Oh, wow.
self-paced courses or flexible courses I used to take. I so far I've completed like 60 plus online courses. One thing. Second thing, LinkedIn is a great platform where you can see like-minded people. Okay, they post a
Mm.
lot of contents. I consume a lot of content from that. Um, Third thing, I would be reading 1 or 2 research articles in a day. So I
Wow.
used to all these things to keep
That's
myself updated.
amazing. Now I'm listening to you and I'm thinking of a couple of my guests and I'm like, I need to step up my game. But no, that's beautiful. I'm getting closer to having you, live here and go to bed. But before we get there, tell me, what do you do for fun when you're not working or expanding your knowledge and so forth?
I talk to my friends. I sing actually.
You
I do that.
sing.
Yes, I
Oh,
sing.
that's beautiful. Do you sing at church, in the community, or like do you just do it for fun?
It's just for fun, and I'm a poet. I write poems related to medical field. I write poems related to love. So I basically write poems.
That's beautiful. Now I want to read one. That's beautiful. Okay, so that's beautiful. What do you then do? Actually, before I get to the last question, what are some demographics do you see as a patient in your clinical site? What demographic of patients are you seeing? Age, a different diagnosis?
Mostly people about like 30 years. I was working in a clinic like orthopedic clinic for the last year. I used to get patients with multiple neck pain. The commonest musculoskeletal pain I used to get like knee pain, shoulder pain, or neck pain,
Mm-hmm.
like those kind of patients I used to get. And
Okay.
after telerehab, I was getting patients like most of post-COVID patients I'm getting.
Okay. All right. That makes sense. And lastly, what would you advise for somebody wanting to become a physical therapist or a physiotherapist in India right now?
If you look into this profession, if you want to come, immediately say yes and enroll yourself into physical therapy profession. I would say the opportunities are very vast. It is very wider. Always keep your eyes open. Always self-motivate yourself. You're going to treat other human beings because there are
Mm,
like millions of people are living with chronic diseases.
mm,
You are here to help them, to cure them, to heal them. Because I see a lot of people are calling themselves as wellness coach and health coach without certified. We are the
mm,
people here to reduce their opioid dependency, to increase their quality of life.
mhm.
So there are multiple opportunities out there. Have skills, equip yourself, take this profession. Don't help
That
you.
Yeah, that's beautiful. That's beautiful. Well, Dr. Kaviarasi, thank you so much for joining me. For especially in this, it's what is it? Almost 11 p.m. over there now.
Yes, it's 10:30 p.m.
Yeah. So thank you so much for taking the time to join us here and shed more light on your profession in your part of the world. I absolutely love learning more about you, what you do, and how you do it. Again, thank you so much.
Thank you so much, Senan, for having me in your podcast. It's a lovely evening here for me. Thank you so much.
It is my pleasure. Now you have a beautiful evening and enjoy the rest of your, well, I guess the weekend is over for you
Yeah,
practically.
yeah, absolutely. I have Monday tomorrow.
So I should say enjoy your week. May you have a blessed week. How about that?
Thank you. Thank you so much. Take care.
Uh, you're welcome. Bye.
Bye.
All right, I'm back. Physiotherapists and physical therapists are just two different words to say the same thing. So they're synonyms they're the same thing. There's no difference between physical therapist and a physiotherapist. Different countries like India will use the word physiotherapist more, and countries like where we are in the US will use physical therapist more. But the two words are designating the same profession. I hope you'll enjoy the interview. Adios. Alright, that's all I have for you today. Thank you again for joining me. I appreciate you. Please subscribe, follow, like, comment, and share. And stay blessed. Bye.